All right, if you're a PA student about to start your PEDS rotation, then you are in the perfect spot. Seriously, the well-child visit is the absolute backbone of pediatrics, and today we're handing you the complete blueprint for that 4 to 6 month checkup. This is going to be a clear, actionable guide you can take with you from day one. Okay, let's jump right in.
So why is this one visit so critical? Well, get this. 1 in 4 children under the age of 5 are at risk for developmental delays. That number is huge, and it means that you, in your clinic, on every single shift, are on the front lines. Your sharp eyes and ears are what can catch these risks early. So yeah, this visit really matters. So, here's our game plan for today. We're going to start with the basic 3-step blueprint for any well visit. Then we'll dive into the nitty-gritty, how to take a great history, nail the physical exam, and use a brilliant little framework called Nests and Fly for parent guidance. And then we'll wrap up with the key screenings and immunizations for this age. You know, every great clinical encounter starts with a solid framework. And this isn't just about checking off a bunch of boxes, right? It's about creating a structure that helps you be both super thorough and efficient. That way, you can focus on what actually matters, the baby and their family.
It really just boils down to these 3 core steps. First, you listen, and you gather all the information. That's your subjective history. Second, you observe and you collect the data. That's the objective exam. And third, you educate and you make a plan, providing that crucial anticipatory guidance. This is the rhythm of every single well-child check. You get this down, and you're golden. Okay, let's put on our detective hats and dive into step 1, the history. This is where you're going to be listening for clues, and not just in what the parents are telling you, but in how they're saying it, and how that little one is interacting with the world, right there in front of you.
And this question right here, this is your single most powerful tool. Before you even think about launching into your checklist, always, and I mean always, start by just asking the parent or caregiver what's on your mind. It's such a simple question, but it builds immediate trust and makes sure their biggest worries get addressed right from the get-go.
So I want you to think of the patient's story like a book. And these right here, these are the essential chapters. You've got to know how the story began. That's the birth history and newborn screenings. You need to know about the plot twists, their immunization status, and what their diet's like. And you absolutely have to understand the setting, the social dynamics at home, and of course, how they're hitting those developmental milestones.
Now, what's so important to get here is that you're not just checking off milestones for today's visit. You're performing what's called developmental surveillance. And what that means is it's a continuous process. You're observing, you're listening to what the parents are concerned about, identifying any risks, and documenting everything at every single visit. It's a true partnership that you build over time. Okay, so we've listened. Now it's time to look and to measure. We're shifting from the subjective part of the visit to the objective. This is where we gather the hard data, the measurements, and the physical findings that are going to paint a really clear picture of this infant's growth and physical health. You know, precision is everything here. For weight, it's always diaper off, no exceptions. For length, you have to measure the infant lying down until they're 2 years old to get an accurate number. Head circumference, you want to measure at the widest point. And for vitals, please don't estimate. You have to count that heart rate and respiratory rate for a full 60 seconds. An infant's breathing can be kind of irregular, so a full minute is the only way you're going to get a true reading.
Now, during your head exam, here's a key clinical pearl for this specific age. By the time they're 4 to 6 months old, the posterior fontanelle, that's the smaller soft spot at the back of the head, it should be closed. The bigger one on top, the anterior fontanelle, well, that's going to still be soft, flat, and open.
Think of this as your cheat sheet for the neuro exam. It's like a developmental report card for the nervous system. The Moro, or startle reflex, the stepping reflex, and the suck reflex, those should all be gone by now. But you should still be able to easily find the Palmar grasp, the Babinski, and the others you see here. It's a fantastic way to quickly assess if that central nervous system is maturing right on schedule.
So you've got your history, you've got your exam findings. Now for the grand finale, the parent education part. This can feel like the trickiest part of the visit, but I've got a secret weapon for you. The Nests and Fly mnemonic. This little tool is about to be your new best friend for structuring this conversation perfectly every single time.
Let's kick it off with N for nutrition. For breastfed babies, we're talking frequent feedings plus vitamin D and iron supplements. For formula-fed babies, it's about 30-32 ounces a day. Then there's the big topic, first foods. They are ready to start when they can sit up without support and they've lost that tongue thrust reflex. You'll want to remind parents to introduce new foods slowly. And of course, the critical rule, absolutely no honey before age 1.
Next up,
E is for elimination, and S is for sleep. You'll want to reassure parents that 6 to 8 wet diapers a day is a great sign of good hydration, and that their baby's stool is definitely going to change once solids start. For sleep, the goal is about 12 to 16 hours total. Advise them to try putting the baby down drowsy but awake to help them learn to self-soothe. And here's a massive safety point. Once that baby shows any sign of trying to roll over, it is time to stop swaddling.
Now for T, which is trajectory, and another S for safety. When you're looking at those growth charts, you want to see that the birth weight has doubled by now. And on the safety front, well, new mobility means new risks. As they start rolling around, the fall risk just skyrockets. This is the perfect time to chat about baby-proofing the house, the dangers of smoke exposure, and why learning infant CPR is so important.
And that brings us to the fly part of our framework, starting with F for family. You have to remember, your patient might be the infant, but you're really treating the whole family system. This is your chance to check in with the parents, to ask how they're doing, how they're coping. And you can talk about the bigger picture, like sibling dynamics, childcare plans, and what their support system looks like.
L is for learning, which is where we circle right back to those key developmental milestones. At this stage, you're looking for gross motor skills, like sitting up with support and rolling over both ways. For fine motor, you're looking for them reaching for toys and passing them from one hand to the other. Language-wise, they should be babbling and responding to their name. And for social milestones, you'll see spontaneous smiles and maybe even the very beginnings of stranger anxiety.
We are in the home stretch of our visit blueprint. The final pieces of the puzzle are the preventative screenings and all the scheduled immunizations that protect this little one and set them up for a healthy future.
And remember, you're caring for the whole family unit, right? That's exactly why screening the mother for postpartum depression is a standard of care. You'll also do a quick risk assessment for iron deficiency anemia, which is super important for breastfed infants, and you'll start assessing for oral health risks because those first teeth might be just around the corner.
Okay, let's lock in the vaccination schedule. The 4-month visit is pretty straightforward. It's typically the second dose of 5 key vaccines. Then, the 6-month visit delivers the 3rd dose for a bunch of those, plus the 3rd dose of hepatitis B. Knowing this schedule cold is a core competency for any PA and PEDS, for sure.
So, as we wrap things up, let's just come back to this core idea one more time. This isn't just about one visit or one checklist or one single moment time. Your job is to engage in this ongoing developmental surveillance, building a real relationship with the family to monitor that child's health journey for many visits to come.
We've given you the clinical blueprint, the questions to ask, the exam to perform, the data you need to collect. But a blueprint is just a plan. The real art of medicine is turning that plan into a partnership. So the question I want to leave you with is this: how will you build the trust that makes that partnership really happen?
And as you think about that, here are some phenomenal resources you can add to your toolkit. Bright Futures and the CDC's Learn the Science program are absolutely indispensable. I highly recommend you bookmark all of these as you continue your journey in pediatrics. Thanks for joining me for this explainer.